Happy spring. My landscape is starting to bloom. It's getting warmer. There is hope in the air. Now, a lot of that hope is about the progress that America is making on vaccination and the thought that this pandemic might actually be retreating. Over the past couple of weeks, we have heard a lot about vaccines. We have all become experts on the different types, changes to the distribution timelines, and availability. I'm going to talk about how vaccination impacts you today and where we're going on it as an agency. We now have 3 COVID-19 vaccines being administered across the state. You may think you prefer one over the other, but what we are hearing from scientists across the board is that the most effective vaccine is the one that is available to you now. Unless you have a specific health issue pushing you to one or the other, they all protect you amazingly well against severe disease. More and more DCYF staff are eligible for the vaccine as a result of their job duties. Last month, I sent a letter to 2,716 staff certifying their eligibility under Phase 1A. The goal here was to ensure as much of our frontline staff were protected as possible. We pushed DOH and OFM pretty hard on this. Starting tomorrow, March 17th, the remainder of JR institution and facility staff who were not eligible in Phase 1A will be eligible in Phase 1B2. I think there's about 285 people. You will receive a letter from me if you are in this category. You can take these letters to your vaccine providers to show eligibility. You may also be eligible because of your personal health characteristics. Currently, all staff over 65 and any staff over 50 living in multi-generational households are eligible for a vaccine. Under the current plan, all staff over 50 with 2 or more medical conditions will be eligible starting April 12th. 2 weeks later, beginning April 26th, we should see staff of all ages with 2 or more medical conditions become eligible. President Biden is directing all states to open eligibility to every adult by May 1st. My guess is that this will happen here in our Washington, but we do not yet know for sure. That's 6 weeks from now. For eligibility to mean anything in reality, we'll need an increase in vaccine availability. But this is improving on a daily basis. Now, inventory varies daily, so patience is key. If you are one of the lucky ones who want the vaccine and you get a call from your pharmacist, your healthcare provider, somebody who's got 3 extra doses at the end of the day, they give you an opportunity to get vaccinated, please take it. As a reminder, you are not considered fully protected until 2 weeks after your second dose or 2 weeks after you get a single dose vaccine. We are all part of the communities in which we live and work, and we all care about each other. You wouldn't work for DCYF if you didn't. As folks become fully vaccinated, we will need to continue to do our part to protect ourselves and others. Regardless of your vaccination status, please continue wearing a mask. Stay at least 6 feet from others and avoid crowds and poorly ventilated spaces. The CDC also recommends that you take precautions when gathering with unvaccinated people who are at high risk of serious illness from COVID-19, like your grandmother. I hope we are all able to gather safely with our loved ones in the coming months. I know I'm really missing it. Stay healthy, stay safe, and wear your mask. Thank you.